she thought her uterus was going to fall out, which is why we started the video with that, because
she was ready to get on disability. She was so nervous about it.
I've had a couple of people tell me that their nipples get too sensitive. I'm like, I don't know if that's such a thing. Like, I don't know if there is a thing. I don't know about that.
Here right now, Labiaplasty is up 150%. I think it's even more now. But we've got the next generation of that without downtime, without losing sensation. We're going to make it all better in every way.
So that story that women hear about having so many children that your uterus is going to fall out, as if it's going to just pack its bags and exit stage left. No, that's a myth, but pelvic floor prolapse is not a myth. And so that prolapse is what we're going to talk about today, but the reality of that, not the myth or the story. So welcome back to the channel. It's Dr. Durst, and I have a special guest with me today who has sat through many consults with me when a woman is concerned about uterine prolapse. And so welcome, Marissa.
Hello.
So Marissa Staten has been with me for a long time. Well, we've known each other for a very long time. We won't date each other right now, but it's been a while. And we do all of the vaginal rejuvenation treatments together. And we have, a transformative treatment for women, the 4V.
Mm-hmm.
And together we have made that into its own unique vaginal facelift. And so we're both very passionate about it, but Marissa does that treatment on a daily basis and just watches things transform in front of her eyes. Right?
Ladies, you're welcome.
Yeah, you're welcome. Better sex. That's always something to be welcome for. So, but we're going to talk about prolapse today because a pelvic organ prolapse is quite common. And having done vaginal exams for decades in the ER, and then fast forwarding to sexual wellness as a specialty, and also doing pelvic exams on a regular basis, it is just so common that women will have some sort of pelvic organ prolapse. And so that's what we're going to talk about today, how common it is, what it is, and what you can do about it. And so what is pelvic organ prolapse? And I'll just go into, again, anytime that you have pelvic floor weakening so that you have ligaments that hold that uterus and vagina, uterus, the cervical or the upper vagina in place. And anytime you get weakening, which is pretty common with childbirth, then you can have some prolapse or some weakening that one of those organs might start to prolapse or kind of sink into the vaginal canal. So that can be the bladder or cystocele, that can be the rectum or rectocele, it can be uterine or uterine prolapse. And there are definitely some other things that can prolapse too, but those are the most common ones. But I will just say that about 50% of women will have that, especially if you've had vaginal deliveries. And it's also quite common after a hysterectomy. And so those are the facts, that it's common. It's not something that I haven't seen over and over again. And I think we're going to get to a point where we actually do vaginal rejuvenation in between pregnancies and deliveries so that we don't see that and we keep everything tight and we keep all the collagen built. And I think that's definitely going to be the move. In another decade, we will be seeing people in between pregnant, actually our staff, because we have some young pregnant ones right now. So I think we're going to start to do our own little isolated study on that. But up to 50% of women who delivered vaginally, and again, that's significant, but up to about 20% of women will end up having some kind of surgery related to a prolapse, and that's significant. And so the fact that you can do some non-surgical treatments, and that's what we're going to talk about today. And I thought that Marissa and I could start by talking about, we'll get into how common it is in practice, just illustrating the one case that we had together that I think for you and I, having done it for years, that this case was us realizing that we really probably weren't speaking the same language as the patient or even the laser companies necessarily.
I agree.
Kind of a funny story, but not funny, but it had a good ending. So it can be funny now. But basically, we had a lady that hiked a lot, and she was in her late 40s, maybe early 50s. And she had come in because she had severe prolapse. And again, mild to moderate severe, or mild to moderate, is like that vaginal rejuvenation for sure. Moderate to severe, still, unless if you have something that's actually prolapsing out that's visible, is still worth treatment, and we see improvement. But this
Absolutely.
one thought it was severe. She thought her uterus was going to fall out, which is why we started the video with that, because
She was ready to get on disability. She was so nervous about it.
she was, and she hiked. She loved hiking. Do you
Mhm.
remember that story where she had hiked so many things? And we don't have big mountains around here, but she was traveling and hiking big mountains and hiked everything in this area and stopped because her gynecologist did an exam and basically scared her to thinking that her uterus was going to fall out. Like, seriously. She came to us, and she came to us from a distance.
Mhm.
It's probably like an hour drive, an hour and a half drive.
If I remember correctly, yes.
Yeah, the Tri-City area, right?
Mhm.
And she had seen an office up there who recommended that she come down to us. They do have a Fotona, but they don't do vaginal or women's health treatments. And so they referred her down. And so she was super nervous. And Marissa had her in the room, and we're getting ready to do a pelvic exam. And I think Marissa was nervous as well. And she had done a ton of these. And so I couldn't understand why she was nervous. But I think that the lady was describing it as a prolapse in a severe one that Marissa wasn't sure what we were going to find. And
The
so,
severe prolapse I've seen was pretty severe.
I mean, you just didn't know what is you're looking, you're expecting something different. But what did you end up seeing with me that day?
Very little prolapse. I
Yeah.
mean, it was there, don't get me wrong, but nothing like we expected.
Nothing that we don't see on a regular basis, right?
Exactly. 1 in 4 women.
And I think that, to me, that meant that I think all the pelvic exams I did in the ER, and when you put a speculum in the vaginal canal and you start to bring it out and the walls kind of collapse around it, is very common. But a lot of those women were post childbirth and delivery. And so it's very common. They weren't really symptomatic with it, but they would start to have the usual symptoms like laxity or urinary incontinence, like the usual things that they complain, decreased orgasmic strength. And then as hormones start to decline, vaginal dryness, right? And
Right. Exactly.
lubrication issues. But she had a pretty normal exam for what we see on a regular basis. And so Marissa has seen a lot of those exams. So at the end of it all, she was kind of shocked because I just don't think we had heard the term like prolapse in such a severe, she's ready to get on disability type of scenario. And so you're like, yeah. And so we basically looked at her and said, like, you're nothing special. And she was happy about that. And so she's like, I'm going to go home and tell my husband I'm nothing special. And I said, when we tell you that, that's actually a good thing.
Very good thing.
Yeah. And so it was mild to moderate prolapse and vaginal prolapse, just vaginal wall prolapse. And so there wasn't, anything coming out. Otherwise, the exam was normal. The cervix is where it should be, all of that. And so she just had vaginal wall relaxation, essentially, which is considered prolapse. So anything that has laxity that starts to fold into the vaginal canal is prolapse in some way. So again, up to 50% of women that have had children are going to have that. And so very common on exams. So, but to your point, like, you're doing this all day long. And so the treatments, that's what we're going to get into. One of our favorite treatments is a laser vaginal rejuvenation. And we're talking about internal treatments. And so I'm going to let Marissa kind of explain how that goes down typically, how women end up in front of us first off, and then we'll talk about, what that looks like, what kind of process that is. We meet with them and how we make, treatment decisions and what that treatment looks like and, the results of it. And we're all talking about internal. We will get to the external, but we're going to segue into that at the end of this video and then do another one on just the facelift. But yeah, tell us a little bit about like how a woman ends up in front of us. Like what's the usual experience?
The
with
usual
them?
is incontinence, vaginal dryness, a scare of a prolapse or severe prolapse, but something that is concerning, and we've opened the door for them to feel comfortable with us because we do so much in sexual wellness, more for women and equally as men, but most women do not find the information about all the things that we offer in one place. It's scattered throughout the internet.
Mm-hmm.
So here we are. And they come to see us because they automatically feel comfortable with your podcast and the details that we offer, and well, our website for all the details. But so they're here and they're having incontinence, possible prolapse, vaginal dryness, and they're like, "What can you help me with?" And they think they're a loss. They think no one can help them, and here they are. And then we let them know that. Fortunately, they're nothing special, and we've got many things for them. And the intravaginal with the Fotona laser for the GYN is just very easy to perform and comfortable and no downtime. So it's so easy.
So we have multiple lasers. The one that we're talking about that we did with this lady, and in particular, the Fotona does advertise for almost every type of prolapse, which is great. Mm-hmm. So if you go to their website, and it's definitely an international Slovenia-based company, and so they will talk a lot about the vaginal treatments, but in the U.S. are very limited in what they can say it treats. Mm-hmm. But they're FDA-approved devices, and so therefore we can treat those conditions and see improvement. And again, we tend to say, that we don't, treat anything in particular or cure, but women with those conditions do see significant improvement. That's a good way to put it, to keep everyone. But again, it's hard to do randomize, controlled study. You're either getting heat with a vaginal rejuvenation or you're not. It's a regenerative treatment, so you don't get pharmaceutical backing. So if we're waiting for big studies, there are lots of studies, and there are lots of studies that show complete safety in these procedures. And so to me, that's what matters. And what we're doing is, getting results. This is years, almost a decade of results with it. And so with the Fotona, that's an erbium. So that's a laser, because some of them are like radio frequency and
2940 nanometer wavelength.
Yeah, so the erbium. And then we're really heating, not ablating, right?
Subablative treatment with the 2940 nanometer wavelength. So it's not going to ablate at all. It's going to be very comfortable, a little warm in certain spots, but it's going to automatically, with the heat involved, tighten the mucosa layer that the vaginal canal consists of.
And so when we say non-ablative, we mean it's not going to ablate. Ablate means you're going to remove some of the tissue on the top. So erbium and CO2 are two modalities that are typically considered ablative. And so CO2, obviously, when you think about CO2 in the face, and you can do CO2 vaginally, but those are ablative procedures, and erbium is too. And there's other lasers that do have ablative, but I always say there's just not the downtime when you're not ablating the tissue.
Right.
So that you haven't taken anything off.
The smooth mode as a subablative treatment is not going to have any downtime whatsoever. That's the good thing, because that's always the worry. Who wants to have 7 days of downtime? No bathtubs, no saunas, no sex, of course. And then, no, that's not an issue at all with this type of treatment.
It's the hardest thing for us to tell people not to have sex for a few days. It just is. I'm just going to say it.
If you wanted more people to have sex, tell them not to.
Yeah.
And then see what happens.
Yeah, that's true. They're always going to do the opposite. Yeah, it's a dare. Don't have sex. but it's really hard for me. Like a PSA is elevated in like a male patient, and we're just trying to say like, hey, before your next test, to make sure that there wasn't anything from a prostate activity or, just maybe not sex and ejaculation for, 48 hours before, just to, take that out of the equation. It's really hard for us to do so. And so we don't do the ablative, but not for that reason, obviously. But I think that the downtime is less because you don't have to. And of course, that procedure, I also like that there's a speculum that goes in, and then the robotic arm is going in and out of the speculum.
Yes. The glass speculum stays on the inside, and the laser handpiece or the articulating arm tip goes inside that and rotates. So that's it. The laser does everything.
Yeah.
So you don't take the speculum out, you leave it in, you change hand pieces or tips, if you will, lack of a better term at the moment, and voila.
Yeah, because that laser is shooting through the tissue, and it's shooting and it's going around and it's doing the treatment. It is a robotic arm that is doing the treatment for you. And there's multiple different, settings that we do so that we're hitting the entire vaginal canal, the anterior vaginal wall.
Precise precision.
Yes. No, it's painless. Completely painless. Like I would say that I have not had a woman complain of pain with the Fotona procedure.
No.
And there's other ones that we do too. And most of them are completely painless. Like if anything, it's maybe like a 1 or 2. So the fact that you can do an in-office procedure, no pain, no downtime, and have regeneration of tissue, no cutting and no drugs is phenomenal. Amazing. Like, so you only need to give me some study support to show efficacy and safety for me to start to incorporate it into practice, which we did like 2019.
Yeah.
Yeah, it's been that long. And we haven't had adverse effects with it. So, and we have, I would say, close to probably a 99% satisfaction rate. And we do base it on the patient's concerns. So like, again, if it's mild to moderate, if it's a little more, sometimes we're recommending a different modality in addition to this one.
Yes.
We do injectable regenerative procedures with the O-Shot and PRP, which pair fabulously with this. And then you can put PRP. You're already putting PRP in the nipple. And then we will come out to, because this Fotona internal is treating everything functionally internally. So urinary incontinence, vaginal dryness, better blood flow, better orgasmic strength, prolapse, tightening, collagen, elastin, all of that. And tightening, which is significant if you've had vaginal delivery. I mean, that is the Prolapse is tightening, but again, just so that you know, that is tightening. And friction is better sex for both partners. So, but I think that we can come to the outside with multiple treatments with this machine. And the O-Shot starts that because we will do an injectable PRP in the anterior vaginal wall, G-spot area, and the clitoris. And again, while it sounds painful, it's not. No one will believe us until they actually have one done. And then they're like, that was it. But you can do nipples and bring back nipple sensitivity with that too. Highly recommended. And women come back for the nipples like right after, because again, post-surgery, like in breast implants, they don't have nipple sensitivity. And in fact, we just did one on one of our staff who would really never had nipple sensitivity. And we just did hers last week. And she texted me and said, I have nipple sensitivity and better orgasmic strength. And again, it's regenerative. So I don't really expect much for 3 weeks to 3 months when it's regenerating. But yeah.
It makes you love the wind blowing.
Right.
It's a very nice summer breeze.
Yeah, very sensitive. I've had a couple of people tell me that their nipples get too sensitive. I'm like, I don't know if that's such a thing. Like, I don't know if there is a thing. I don't know about that. But anyhow, but I do want you to tell us a little bit about your clitoral, like and what you've named it. So we can come to the outside with this so that we're focusing in on the clitoris. Tell us about that procedure.
The clitoral stimulation is 4 minutes of the best foreplay ever, and it's done with a 1064 nanometer wavelength. and it's literally 4 minutes.
Yeah.
4 minutes.
4 minutes that we're doing a laser light photobiomodulation to the clitoris. So now if you think about the clitoris, and we should have brought that, like we have a little device, a little clitoral device, but I think it's upstairs in my office. But we'll get it for the next video. It like basically what you're seeing is just the gland, so it's just the tip. But the clitoris is the male penis, and it's erectile tissue.
Yes.
And so it has double, probably even more nerve fibers.
8,000 nerves?
8,000, but they're actually
The nerve to get on?
with recent studies with trans operations, I think that actually has went up, at least for concentration in the glands of the penis versus the glands of the clitoris. I think it could be up to 6 times as many nerve endings. So regardless, it's very sensitive, and you should definitely be on those nerves. That's for sure. That's our going joke with it. That is one that you should focus in on because it is erectile tissue for women. So if we're doing the laser device, just know that in the labia, those are the body of the clitoris or underneath the labia.
legs,
and so, so you want to end up hitting that and using the laser light energy to bring stem cells to the area and regenerate everything.
Exactly.
Yeah.
Your own natural stem cells and growth factors with the micro injuries that we're creating with the heat involved. Your body's sending all that there to repair and
it's 4 minutes,
stimulation.
4 minutes until better foreplay with that. And all women love it. Love it. So we can go, like what we can do with vaginal rejuvenation is just unbelievable. We are just getting started with that because I don't think that's out there enough. And we're going to let people know about it more and more. Because it's just, we're very passionate about it, and we haven't even gotten to the facelift part of it. So that's the external, and that is just aesthetics. But we'll go into just a short bit before we end.
We're giving the women a reason to keep the lights on.
Yes, I love that.
For them.
Yeah, you always have.
For themselves.
We're rebuilding. Like sex, the female sex system for women. It's just like it's a full package, and we're just rebuilding it. But I love that, like giving the woman a reason to have the lights on. Let them get familiar with it. Let them learn, get to know. They need to get close, and they need to get down there and get close. So I think that that's perfect. But so that you understand what we're saying. And we're going to throw a 4V before and after up at the end of the video or a couple of them, just to highlight it is a hard thing to actually, and we might get into trouble for it, who knows, but it's a hard thing to showcase.
Won't be the first time.
No, it won't be the first time at all.
Nor the last.
No, everything's a suggestion. So I think that we're going to throw one up just so you can see. But go to our website. We'll also put a link in the description that says the Fotona 4V. The 4V is our trademarked version of it because we do the 4D on the laser or on the face, which is a non-surgical facelift with a laser. This same laser, which is an amazing laser. Yes. And not many offices have this laser. But again, it's just one of the ones that we do for vaginal rejuvenation because you want a lot of different tools in the toolbox for whatever we might need. But this one machine does a lot. And so when we come to the outside, we called it the 4V because it was the 4D on the face. And you can do 4 laser steps and do a non-surgical facelift, which is great. But the vaginal, like the labia, respond a lot faster because it's not mucosa like the vaginal canal. It's not skin like the face. So it's that transition zone. At least that's my theory because it does respond fast. I'm going to let Marissa tell you about how she can see that transformation while she's doing the procedure. So I'm just the voice piece, because I love the first one we did was amazing. She came out and showed me, and it was, again, 1 hour later, and the transformation was amazing. We'll put that one up for the first one ever, and then we'll show you just some other ones that look just like normal vaginas again. I think that we've seen,
Perfectly healthy vulva.
yeah, perfectly healthy. Like,
Mhm.
again, I did ER forever. We've done a ton of pelvic exams, and we do a lot of sexual wellness, and they all look different. It's just like a fingerprint or a lip print. Never thought they needed to look prettier, but now that I know we can make them look prettier, we highly recommend it if you have a vagina or a vulva that we are making vaginas great again. So I'm going to have you tell them about that,
Mhm.
just how easy that one is for the patient.
Very easy treatment, no downtime, no numbing, near as painless. It's wonderful. And we treat the labia majora as well as the minora and majora to tighten the labia without cutting. You actually increase more blood flow, as we mentioned about the clitoral stim. You, with the micro injuries that we are creating in the vulva labia area, you're getting more sensation. So it's just amazing what you can do and why you want to leave the lights on now.
Yeah, no, it is amazing. You're
Just
going to
makes
see
it prettier.
it makes it prettier and tighter. And a lot of it is just like, again,
We
like
can make
Betty
it
White
tighter
said,
and
it takes a
brighter.
beating it takes a beating. And I mean, Betty White said it, right?
She said it best.
Yeah, she said it best. It takes a beating. So
Without apologies.
Just tighten that up right out. Just tighten it up. That's all. Leave it out and tighten it up. We don't have like the cup protecting us. No, that vagina's out there. Like, it's just taking a beating.
Yes.
Yeah.
So I hear right now, Labiaplasty is up 150%. I think it's even more now.
Yeah, no, it's high.
But we've got the next generation of that without downtime, without losing sensation. We're going to make it all better in
Yeah.
every way.
If you were thinking about a labiaplasty, you definitely want to look at our before and afters and the 4V, and it is our trademarked version of it. The Fotona is something other offices can do, but not many do. But just reach out to us. There's no reason to at
Yeah.
first get an evaluation and see if that non-surgical option might be right for you. Plus, you get all the other functional improvement because we can do the internal. So clitoris, better nipple stimulation, better orgasmic strength with clitoral stimulation, everything. It is a rebuild for women.
Why
Better
not?
sex for women,
is
right?
the question. Why not?
Yes, no. It is, again, a rebuild of medicine for women, comprehensively treating it from the inside out, hormone, cellular, optimization, and then regeneration all the way around. So if you're having any of the symptoms that we talked about, prolapse, urine incontinence, laxity, dryness, and decreased orgasmic strength, any of that, then give us a call. Or you feel like that you don't look normal on the outside. It turns out that about 50% of women are unhappy with their vaginas. And no, we're not trying to make women feel that their vagina needs anything done. But just know that if you're bothered by something, you also don't need to listen to other people tell you that it's not important. I think if it's important to you, it's important to us. And you just want to know what your options are. So
It's all about that.
that's it.
It's about you.
It's about you and
In
just
every way.
empowering you to have better sex at all ages. And that's why we have rebuilt medicine for women. It's what we call the female sex system instead of the female reproductive system, because we're focused on better sex for women because we have a lot more of that than we do babies. So,
Oh, yeah.
yeah. So anyhow, let us know if there is anything else you want to talk about, because we are willing to dive into anything, wellness or sexual wellness. Let's start a conversation in the comments.